Welcome back to Droanacharya IAS YouTube channel. You're watching daily editorial analysis and आज इस वीडियो लेक्चर में हम पब्लिक हेल्थ सिस्टम डिस्कस करने वाले हैं. दिस इशू इज़ वेरी इंपॉर्टेंट फ्रॉम जीएस पेपर 2 पॉइंट ऑफ व्यू. हेल्थ परस्पेक्टिव से काफ़ी इंपॉर्टेंट इशू है पब्लिक हेल्थ सिस्टम इन इंडिया. नाउ रिसेंटली ये ऑब्ज़र्व किया गया है, हमने थोड़े कुछ मंथ्स पहले भी जब हेल्थ सेक्टर को लेकर जब भी डिस्कशन होती है तो ये बात निकल के आती है दैट एज ऑफ नाउ इफ वी सी द टुडेज नीड्स, जो चैलेंजेस हमारे पास आ रहे हैं इन टर्म्स ऑफ पब्लिक हेल्थ इज़ अ सेपरेट प्रोफेशन एंड वी रिक्वायर some specific set of competencies, some separate set of qualifications, standard operating procedures for public health. This has been well observed now. एंड आज इस वीडियो लेक्चर में सबसे पहले हमारा इंडिया का जो हेल्थ सेक्टर है हम एक उसका ओवरव्यू लेंगे. विल सी द पोटेंशियल ऑफ अ हेल्थ सेक्टर एंड विल टॉक अबाउट पब्लिक हेल्थ एज अ सेपरेट प्रोफेशन. सो लेट्स बिगिन विद टुडेज वीडियो. एज आई सेड, ये टॉपिक जीएस पेपर 2 मेंस पर्सपेक्टिव से काफ़ी इंपॉर्टेंट है. सो लेट्स टॉक अबाउट द हेल्थ सेक्टर ऑफ इंडिया. नाउ इंडिया में हमारा जो हेल्थ सेक्टर है इसे हम 2 कैटेगरीज में डिवाइड करते हैं. इसके मेजर 2 कंपोनेंट्स हैं. एक है पब्लिक एंड द सेकंड वन इज प्राइवेट. इंडिया की हेल्थ केयर डिलीवरी सिस्टम को हम 2 कंपोनेंट्स में डिवाइड कर सकते हैं, पब्लिक एंड प्राइवेट. जब हम गवर्नमेंट की बात करते हैं, पब्लिक हेल्थ केयर सिस्टम की बात करते हैं, तो इसमें सेकेंडरी और टर्शरी केयर इंस्टीट्यूशंस जो सिटीज़ में हैं वो इंक्लूड हो जाती हैं और रूरल एरियाज़ में जो प्राइमरी हेल्थ केयर सेंटर्स हैं वो इसमें इंक्लूड हो जाते हैं. सो इफ़ यू आर टॉकिंग अबाउट द रूरल एरियाज़ देन वी हैव द प्राइमरी हेल्थ केयर सेक्टर्स इन द रूरल एरियाज़ and in the urban areas, in the important cities, we have the secondary and tertiary care institutions. So the government, the public health care system. And when we talk about the private sector, तो private sector में majority secondary और tertiary and even quaternary care institutions present हैं, जो कि mainly metro cities और tier 1 और tier 2 cities जो होते हैं वहाँ पे आपको ज़्यादा robust private sector देखने के लिए मिलता है. Now when we talk about the advantage, the potential of health sector in India, now सबसे बड़ी चीज़ है which is strong demand. It is expected कि इंडिया का जो हेल्थ सेक्टर है it will reach to $372 billion by the end of 2022. हेल्थ सेक्टर, और ऐसा क्यों हो रहा है? फर्स्ट ऑफ ऑल इनकम इंक्रीज हो रही है, क्योंकि देयर इज राइज इन इनकम तो हेल्थ अवेयरनेस भी बढ़ती जा रही है. अलॉन्ग विद राइजिंग इनकम देयर इज ऑल्सो इंक्रीज इन लाइफस्टाइल डिजीजेज, ऑल्सो देयर इज इंक्रीजिंग एक्सेस टू इंश्योरेंस नाउ. तो किन किन वजहों से there is this strong demand of healthcare system in India? First of all, the income is increasing. Income increase होती है तो इसके साथ health awareness जो है वो बढ़ती है. अच्छा, इसी के साथ साथ income increase होने की वजह से lifestyle diseases increase होती हैं and ultimately also insurance cover जो है वो भी इसी के साथ रिलेटेड है. इंश्योरेंस भी इंक्रीज हो रहा है. एज ऑफ 2021 इंडिया का जो हेल्थ केयर सेक्टर है इट इज़ वन ऑफ द इंडियाज़ लार्जेस्ट एम्प्लॉयर बिकॉज इट एम्प्लॉयज अराउंड 4.7 मिलियन पीपल. सो देयर इज स्ट्रॉन्ग डिमांड ऑफ इफ यू टॉक अबाउट हेल्थ केयर इन इंडिया. Also, there are many attractive opportunities here as well. Next we have is attractive opportunities. How come that is possible? See, इसे लेकर अगर हम हमारे इकोनॉमिक सर्वे की बात करें, जो 2022 का इकोनॉमिक सर्वे था, इसमें ये आया था कि हमारा जो पब्लिक एक्सपेंडिचर है हेल्थ केयर के ऊपर दैट इज़ समवेयर अराउंड 2.1% of our GDP. The public expenditure on the health care was around 2.1% ऑफ GDP। और इससे पहले मतलब दिस इज़ फॉर 2021 एंड 22 के लिए ये हमारे पास डाटा आया था। इससे पहले 2020 एंड 21 में ये कुछ 1.8% पे था। इट वॉज 1.8% बैक देन। तो एज वी कैन सी जो पब्लिक एक्सपेंडिचर है ऑन हेल्थ केयर दैट हैज़ इंक्रीज्ड। और यहाँ पे इंडिया की जो 2 वैक्सीन्स हैं, द भारत बायोटेक्स कोवैक्सीन एंड the other one is Covishield, they were instrumental medically in safeguarding India's population against COVID-19. So therefore India is having an attractive opportunity here as well. Plus we have also the rising manpower. We cannot ignore the role of manpower over here, because ultimately we need a large pool of well-trained medical professionals in our country. And there's number of allopathic doctors, those who have medical qualifications. We can take the help of such a trained professionals. We have the manpower in India, and जो numbers हैं वो लगातार बढ़ते जा रहे हैं. And also nothing can be done without government support. तो अभी हमारा जो 2022 and 23 का जो बजट था, इसमें तकरीबन 11.28 बिलियन US डॉलर्स मिनिस्ट्री ऑफ मिनिस्ट्री ऑफ हेल्थ एंड फैमिली हेल्थ केयर को दिया गया था, फैमिली वेलफेयर. इंडियन गवर्नमेंट इज प्लानिंग दैट दे विल इंट्रोड्यूस दिस क्रेडिट इंसेंटिव प्रोग्राम, जिससे कि इंडिया का जो हेल्थ केयर इंफ्रास्ट्रक्चर है वो भी और बूस्टअप हो सके. So as of now, when we talk about India's health sector, there is strong demand in India. There is attractive opportunities for this sector. We also have rising manpower for this, and we also, if we have the right policy and the government support, we can ultimately unleash the potential of it. Now, when we talk about public health system, we only visualize their role in terms of epidemics and pandemics. But we need to realize this कि हमारा जो public health workforce है, they have role even beyond these epidemics and pandemics. If we have trained health workforce, they will ensure that people receive holistic health care. They have preventive and promotive services, जो कि एक बड़ा डोमेन होता है public health में. पब्लिक हेल्थ में प्रिवेंटिव केयर और प्रोमोटिव सर्विसेज बहुत इंपॉर्टेंट होती हैं. उसके बाद मेडिकल केयर में क्यूरेटिव और डायग्नोस्टिक सर्विसेज आ जाती हैं. सो इट बिगिंस फ्रॉम प्रिवेंटिव एंड प्रोमोटिव सर्विसेज, which is the major domain of public health, and also at later stage it involves curative and diagnostic services, which is basically the part of medical care. And one big thing that I want to share here is whenever you are writing about public health, we can use 4 A's. We have 4 A's using which we can describe the public health work. There are 4 A's जिनसे कि हम public health work को describe कर सकते हैं. First is academics. अभी इनको discuss करेंगे, academics. The second one is activism. The third one is administration, and the fourth is advocacy. So using these 4 A's, we can describe public health work. Let's begin with academics. Let's talk about academics का मतलब क्या होता है? It basically means that we have this good understanding of the evidence generation and synthesis, and we have this good grounding when it comes to epidemiology and biostatistics. When you're talking about public health, epidemiology and biostatistics are very, very, very important. Academics plays a very important role, that our public health workers, the workforce, they know how to generate evidence, how to synthesize them, and ultimately do a grounding in terms of epidemiology and biostatistics. इसमें बहुत ही competencies जो हैं, जैसे कि they are very important especially for monitoring and evaluating programs, किस तरह से programs work कर रहे हैं, conducting surveillance, interpreting data and routine reporting of it. So first of all, academics plays a very, very, very important role. The next A is about activism. Now public health is somewhat related to social change. So there is this element of activism to the which is the core of public health. Public health requires that there should be the social mobilization at the grassroots level. And grassroots level पे social mobilization होने के लिए community needs को understand करना होगा, community organization को समझना होगा. So basically it requires grounding in the social and behavioral science. So therefore we can say that activism is the core to public health. Without activism, social change cannot come. The next important A is administration. See, the administration, especially the health systems administration, it happens at different level. Primary health center, then there is district, then there is state, and then there is national level. इसमें जो भी आपके health programs हैं, उनकी implementation, उनकी management, वो यहाँ पे आ जाएगा. Human resource issues को address करना, कहाँ पे workforce की ज़रूरत है, किस तरह की needs हैं, supply chain, logistical issues, इन सब को देखना. It also includes micro level planning delivery, and we need to build teams here, leadership, financial management. All of this is needed for administering the health system at all these different levels. So administration is another important aspect when it comes to public health. Then another K is advocacy. In public health, there is very little that we can do at individual level. The communication is with the key stakeholders, which can change the status quo at different levels of government. Like there should be the clear enunciation of what is the need. There should be the analysis of what could be the alternative set of actions, the cost of implementation or non-implementation. There should be good communication and negotiation skill, which is very critical to perform this function. We also need जो भी health policy से जुड़े हुए subjects हैं, health economy, health advocacy, global health, इन सब के ऊपर एक discussion, एक clear analysis, एक clear plan हमारे पास होना चाहिए. So the 4 A's: academics, activism, administration and advocacy. Then comes application of the public health. देखो ये जो 4 functionalities हैं, these can be applied to a particular problem, a specific problem or a general problem. आप इसे environmental issue के साथ, nutrition, infectious disease, इन सब के साथ लगा सकते हैं. So it can be considered to be similar to super-specialization in other medical fields. Pandemic management requires all the 4 competencies in equal measure. Then training plays an important role. Training in these competencies in India is provided through 3-year MD. Community medicine में 3 साल की MD होती है, and there is 2 years master in public health. These programs, they provide training. So first of all, exclusively there is reserved for doctors. Extra year is devoted to the provision for medical care, and the second one is open to non-medical personnel as well. जो हमारी 3-year MD है वो सिर्फ डॉक्टर्स कर सकते हैं, और जो मास्टर्स इन पब्लिक हेल्थ है that can be done by the non-medical person as well. There is classroom teaching, and जो public health trainees हैं they are posted in communities at different level of health system as well. तो इस तरीके से public health system work करता है. But there are some major issues with it. जैसे कि एक बड़ा issue आता है in terms of poor understanding. Because public health is a multidisciplinary, sector. It basically means that it deals with different things for different people. Many have a poor understanding of it, and they are not able to differentiate between what is public health as a discipline and what is public health sector. So those who are working for state or central government, they are public sector health workers, but they are not doing public health. providing medical care at primary health care centers does not make a person the public health professional. So there is poor understanding of this multidisciplinary field, that we have different people who do different things. And there should be the clear differentiation between public health as a whole discipline and the public health sector. Plus, there is lack of specific competencies. जैसे कि हमने पहले कहा, it is common for the heads of health services at national level, state level, district level to be an orthopedic or the cardiac surgeon or ophthalmologist, but there is no training in the public health. So during pandemic, there were so many doctors, those who didn't have any training of public health, but they providing their expert advice on public health issues. This is because it was felt that public health does not require specific competencies. लेकिन COVID-19 ने clear कर दिया कि no, public health do need specific competencies. We do need people who are trained in public health. Then also there was this quantification related issues. Historically in India, public health has been medicalized. It was largely a college driven discipline, and इसमें it resulted in denying nursing, dental और जो बाकी health professionals and they used to contribute more towards public health, but they do not become public health professional because they do not have those necessary skills. There are qualification issues related to public health sector that we really need to work on, because as we said that public health requires specific competencies, it requires specific training, and for that we need specific qualification related agendas. There are other challenges as well. There is poor expenditure on health sector. We lack affordable healthcare services for marginalized sections of our society even now. There is lack of robust public health infrastructure like hospitals, primary health centers, and plus there is lack of number of doctors and the specialists as per the population of a country, and there is lack of awareness as well. So we need to deal with all these issues for unleashing the public health discipline in India. So it is very critical that जो health professionals हैं, जो government है, जो public है, we should recognize public health as a specific set of competencies, and we need to give importance what it deserves. And for the same regard, our health ministry in its recent proposal, they said that we need to create cadres for public health professionals and health management at state level, district level and block level, and it is a huge welcome step. However, it is not sufficient. There is also a need that we need to look at the quality of public health training which is being provided, because only this will attract brilliant and brightest people into this discipline, which is very important for our country's health. So this is one lesson that we should learn from the pandemic. So there is this urgency that we need to focus on all the levels of healthcare, be it primary healthcare, be it secondary healthcare, be it tertiary healthcare. And it is imperative that government should look towards improving the primary healthcare as primary good. So there is this need for an increase in expenditure on health in India as well, because only then India can improve the existing facilities and we can add more of them. So it is very important issue to recognize public health as a specific set of competencies. तो इसे लेकर काफ़ी अच्छा आर्टिकल पेपर में आया था, and therefore we covered this article in this video. That is all for this video. Thank you so much for watching. I will see you all in my next one. Thank you.